Our next speaker is Dr. Vivien Lim. Now, Dr. Vivien Lim is an endocrinology specialist. She is currently practicing at Gleneagles Medical Center. She graduated from the National University of Singapore Medical School in 1998, and she received a master's in internal medicine in 2008. Now, she has worked as a consultant at Khoo Teck Puat Hospital and has also held the post of Program Director of the Endocrine Residency Program in Khoo Teck Puat Hospital. 所以我们下一个讲座人呢是林医生。那林医生是一名内分泌专科医生，他现在在英格医学中心行医。他在1998年在新加坡国立大学医科学院毕业，以及获得内科硕士。以及在2008年呢，他获得鉴定合格内分泌学专家。他在邱德拔医院担任顾问，也担任内分泌管滴的计划的项目总监。所以他现在讲的科目呢，你可以看到在这个荧幕上，他讲的是降血糖的药物哪一种比较适合我。So today you can see our topic right now is about diabetes medications. How do I know which one is suitable for me? So if already, let's welcome Dr. Vivien Lim with a big round of applause. 我们现在欢迎林医生上台。
Thank you very much for the introduction. I have to say I'm very nervous because I've never done this in my entire life. And I've given a lot of talks. I like giving talks, I like education, but I have to say that this is the first time in my I have to do simultaneous Chinese and English. I almost wanted to turn it down, but I also like challenges, so let's see how badly I do. 谢谢主办当局邀请我。I don't know whether to 谢主办当局邀请我给这个讲堂会，因为我又要讲华文又要讲英文，我的华文真的是没有我的英文好。很远远比不上我的英文，也远远比不上我的 Dr. 黄，我的那个former speaker， 所以你要真的是要多多包涵。I'll try and do my best. Okay, so why I think Dr. Ng went through quite a lot of the slides in terms of diabetes, and I'm very happy about that. That means that I've got more time to try to think about what am I supposed to say in Chinese. So this thing came about a few months ago, and MOH, the Ministry of Health, waged war against diabetes. Now, diabetes has been known to mankind since 5,000 years ago, and even counting and beyond. And yet, it's only now then that we have started having this issue. And why would MOH then start waging war now? And then there are guidelines, then there are big things saying that, 1 in 3, I think Dr. Ng has also gone through it and said, and showed you the percentages of people who have diabetes, and 1 in 3 is generally between 60 to 69. Until you reach that age, we have 1 in 3, and that is really a tremendous number. Now, 我们的新加坡政府呢的健康政府他说，我们宣告了战争，对糖尿病有战争啊，糖尿病在我们的在新加坡，不只是在新加坡，在国际上已经相当大的相当长久的历史了。那很多人都一直抵抗这糖尿病，就好像我们内分泌专科这样子啊。那么有很可怕的几率1/3都是有糖尿病，那真的这个是挺可怕的。那we are now fighting a war. Now, if we are fighting a war, we need to know 3 things. We need to know, number 1, the soldiers which are fighting this war. We need to know the enemy, and then we need to know the weapons before we can discuss then what the weapons are. 我们现在在战争，那战争里面我们需要知道3个东西。一个呢是在战争的军人，他们是谁？第二呢是敌人是谁？第3个呢是什么是武器？他们的目标是什么 ？So let's take a look then at the people. What we first want to talk about are who are these soldiers which are fighting the war? And I think just by looking at the people who have been invited to speak, I think you know already generally some of the specialists who are involved in fighting the war. We have kidney doctors, we have diabetologists, we have endocrinologists, we have dietitians. And we have more with all the doctors which are around. 我们先要知道呢，是谁是那些军人，在战争的军人。那在看我们的节目就知道了，我们有那个肾专科，有内分泌专科，也有那个营养师，还有其他的不同的医生，都是在战争。So, endocrinologist, I do endocrinology. 这个是内分泌专科，我们在做内分泌。很少人会知道什么是内分泌专科，连我自己也不知道什么是内分泌专科，因为我华文不是很好。So I don't even know. So when I was a medical student, I think I had to be taught what endocrinology is. And sometimes when I'm tired now, I can't even pronounce endocrinology. Everybody knows oncology, but no one knows endocrine. Okay, so it's not glamorous at all. You know, kidney doctors, I'm very jealous. Everybody knows kidney doctors, right? Renal doctors, endocrine, what? So what do? So a lot of people, and there's this Hokkien word, okay? So I'm really also not good at Hokkien. I just know how to spout one sentence, okay? Which is okay? Translating to English doesn't sound good. What is it? Can it be eaten? It just doesn't turn out. So, okay. So this is what I do. Glands. You don't know, right? Nothing, I also don't know, yeah. 腺, 荷尔蒙, doesn't sound good, right? Hormones, yeah. Okay, so what's the big deal? Okay, so well, if you look at thyroid, 这个甲状腺, so this is 肾上腺. Yeah, I'm not bad at this Chinese special terms. 肾上腺啊，这个叫脑下垂体. That's very nice. Just hanging from the brain. And then 这个是我们这女性荷尔蒙、男性荷尔蒙. So you sort of know more or less what we are doing now. We've got like thyroids, we've got parathyroids, we've got pituitary, adrenals. And next, what's my next one? And next we have high blood pressure, we have obesity, we have cholesterol, we have osteoporosis, because many of the hormone problems actually cause all this. So 我们骨质疏松症、高血压、肥胖啊，还有高胆固醇，全部都是我们的管辖之内。那最重要的呢，是这个胰脏，是 this pancreas here. So 胰脏我怎么记得是胰脏呢？是 I remember it as 阿姨的丈夫胰脏。不是在开玩笑，我那时候真的不是小的时候，比较年轻的时候，真的忘了，不知道怎么讲啊，就胰脏 ，all right? So why is pancreas? Why is diabetes under us? Because at the heart of it, as Dr. Ng has mentioned, we have an insulin issue, and the pancreas is the producer of insulin, and insulin is a hormone, and that's why diabetes. The specialist for diabetes is an endocrinologist. So 这个 oops, go back. Okay, so 怎么样？ So 这个呢，这个胰脏制造荷尔蒙，那个荷尔蒙叫胰岛素。那胰岛素对我们对糖尿病的患者真的是很重要所以呢。我们是内分泌专科，我们是看腺，看这个胰脏呢是制造荷尔蒙，那个荷尔蒙也是我们的管辖之内，所以糖尿病是我们的管辖之内。So 我们知道谁是军人 ，We know who are the soldiers fighting the war. Now we need to know what about the enemy. Dr. Ng 也是说过了，糖尿病这是什么？这是血液里面含有高量的糖分的一种疾病，而导致不良的结果。那些结果他已经也是给你看，我等一下也会很快的再讲做一次。So what is diabetes? We need to know what it is. We need to define what it is before we know how to treat it. So a disease where there's too much sugar in the blood. So very, very important. It is a disease with too much sugar in the blood. I don't care if there's too much sugar in blood if it doesn't cause anything. But the problem is that too much sugar in the blood actually causes consequences. And therefore, we need to treat what at heart it is, which is too much sugar in the blood, so that we can decrease the consequences. So what is the problem? The main problem is insulin. 最主要的一个问题呢是胰岛素。这是不同的一个图片，可是一样的道理，就是说胰岛素开，那我们糖需要进去细胞，是细胞的能源，所以胰岛素开 那个血糖的门，细胞的血糖的门，让那个血糖进去我们的细胞来做能源。So at the heart of it, insulin. Without insulin, you cannot open the door, and the door allows glucose to be entered into the cell, and for the cell to use it as fuel. So that is the problem. So that's, again, just to show you that that's the pancreas, 胰脏, and that produces insulin, and that's the problem there. So 那个胰岛素缺乏，那缺乏是有2种，一个是绝对的，另外一个是相对的。那时候我们也知道，有那个小孩子的话，真的是缺乏100%的缺乏胰岛素，所以他们一定需要胰岛素，没有胰岛素他们是活不来的。那么另外一个呢是相对的，就是说不一定，它不只是它的抗体，它的抗那个胰岛素的是很高。Let me see. So basically, we have 2 types of deficiency. One is absolute, you absolutely need it, you don't have enough insulin, and the other one is relative, and the relative is a resistance, it's insulin, and so the glucose goes up if there is a, so if there's a resistance to insulin, even though you have the similar amount of insulin, your glucose, the sugars in the blood will go up. So why is it a problem now? So 那时候我就讲了，为什么现在我们的健康总局会宣告战争呢？ Why is it a problem now? This has been there for such a long time. 已经很久很久的历史了。是知己知彼，百战百胜。So if you know your enemy like you know yourself, 100 battles you win, 100 battles you fight, 100 battles you win. So we need to go back to history. 1960s, 1950s. Many of you, I'm sure, were not born. Hopefully, I was not born. But so this is then Singapore. We had riots then. We were third world, 100% third world. We had nothing. We had no food. We had no accommodation. We had no sanitary water. We had lots of riots. We have lots of unrest. So this is Singapore now. 现在这是新加坡，现在繁荣了。We paid the price of prosperity. 繁荣也是有代价。Singapore then, 以前的新加坡 ，please take note of the sizes. 我要你看看，关注他们的体格 ，especially this female here， 尤其是那个女性。这是我们现在的多元种族。OK， 好漂亮哦，白白胖胖。这是我们的肥胖率，它的肥胖率是每6年我们就做一个 health survey， 它的肥胖率就不断的上升。美国比我们更差，可是没有人要跟他比啊，我输了是没有问题的。So if you look at this, our where is this? So this is the rates of obesity, and the rates of obesity has slowly risen. Until 2010, it's 10.8%. Now let's take a look now at the rates of diabetes. And do you notice then it parallels the rates of obesity? 你要看着我们的糖尿病的病率，它的糖尿病率就是跟着我们的跟着那个肥胖率，就是一起上升。所以从这边你就知道了，那个大一个原因是我们的肥胖率就不断的上升。所以如果我们不做什么的话，就不可收拾了。So if we keep increasing in our obesity rates, our diabetes rates will continue to increase. The consequences will be horrendous because our healthcare system will be swamped. And that's why the Ministry of Health has decided that it's time, and that's why they declared the war. And what's more worrisome is that children now are getting diabetes as young as 8, 9, 10, and the reason they're getting diabetes is not because they lack the insulin, but because they're so fat and the resistance is high. And of course, the genes is not that great as well. And so 现在最比较担心的呢，是不单是我们以前想的是50、60、70岁才有糖尿病，现在8岁、10岁都有些跟成年人一样的一个糖尿病，它抵抗那个胰岛素的率真的是很高。No, so why do we care when we have diabetes? Well, Dr. Ng went through that. I'll just go through very quickly. 为什么我们要担心有糖尿病？所以很快就出去，眼睛不多讲了哦，就看了眼睛、肾跟。I need to see what is it in Chinese. My God, I can't read that. Okay, 环 something. 血管疾病. Okay, obviously it was translated. Okay, so 血管疾病. Okay, somebody is shouting to me how to read that. Below knee amputation. Oh, you can read the Chinese, all right? 心脏病爆发，中风。所以呢，因此 So hence we need to decrease all these complications in order to be able to treat the disease and to get better blood sugar control. So 我们真的是要针对血糖的，我们要针对糖尿病，要降低它血糖，我们才可以避免这些并发症。还有一个很重要的东西是明白，糖尿病你不只是要看糖尿病，你也要看糖尿病的好朋友。You need to understand that diabetes treatment is not just treating the sugars. You have to look at its good friends. They have a few good friends. And their high blood pressure and their cholesterol. So 糖尿病有2个好朋友，损友。一个呢是高血压，一个是胆固醇，还有肥胖，而且3个好朋友。所以你要看糖尿病是一并看，不只是看糖尿病，也要看减肥啊，也要看胆固醇，也要看血压高。So we are at war. Now we go on to the third one. What is the weapon? So we now know what diabetes is. Why are we afraid of diabetes? And then let's look at the weapons. So 现在我们知道了什么是对抗糖尿病的军人，要知道什么是糖尿病，为什么会有这个问题，就是一直我们的肥胖就是一直增加。还有第3个呢，现在我们要谈的呢是什么是武器。So treatment of diabetes. So when I treat diabetes, when someone comes to my clinic, there are several things that I do. One, I look out for good friends. Remember the two orang. One was a human friend and 2 orangutans. One was orangutan and 2 human friends. Sorry. So high blood pressure, cholesterol, obesity. You look out for the complications. Okay. So you look at eyes, the kidneys, the nerve. You look at the feet, whether there's a nerve issue going on. You look at the heart. You look at the brain. The medications. Then we discuss the medications. So you need to put down what problems this patient who comes and see you for diabetes has. And then you look at the medications and you think about what medications to use and you discuss this with the patients. And then you discuss what is the best treatment. It must be comprehensive and therefore it encompasses all of this, the complications and the good friends, and it must be customized to that one person. There is no one size fits all. So 我们治疗的时候来到我的诊疗所，我就跟那个病人说，坐下来啊，那我们去慢慢谈。谈的是第一，他有没有好朋友？你不只是要看他的糖尿病，也要看高血压、胆固醇、肥胖。第2，他有没有并发症的？所以，因为我们如果有的话，要一一决定怎么样是最好的方法，什么是药物是最好的方法。如果有不同的并发症，如果有不同的好朋友，那么不同的药物可以用，不只是一种。所以要全面化，所以治疗方法要全面化，也要个人化。So let's look at the weapons that we have so far. These are the targets that we're not going to go through all of them, just to show you, therefore, that there are many targets that we can target for in diabetes. So 我们要看我们不同的，就是战争嘛，战争有不同的武器。 武器有不同的目标，有现在已经很多不同的药物，有不同的目标，全部都可以要慢慢坐下来看看他有什么并发症，有什么好朋友，就用不同的武器也可以拼在一起。So this is not for you to see all the 1,001 things that has happened from 1921 until currently, but just to show that it has been a long-drawn affair in terms of the weapons that we have developed against diabetes. And of course, starting from the number one, in 1921, that was the first time when insulin was discovered and was given to the patient. And then later on, we have oral medications such as sulfonylureas, such as metformin, and people in the audience who has diabetes, this is a very common drug that we use. And as it develops, insulin develops, we have different types of insulin for the big needles in the 1920s, which is very long ago, until now, where they come in disposable pens with very small micro needles of 4 millimeters. Things have changed. So 从1921年到现在的话，很多不同的武器已经被发掘到。那么从有吃的，就好像双胍或者sulfonylureas, I don't remember how to say it in Chinese already. So 那么就不同的时间也有不同的胰岛素也已经制造了，越来越那么到现在呢，还是在制造不同的胰岛素，比较新款的胰岛素。以前要打针是要抽出来的，用那个打针机器要抽出来的，现在就不需要了。那个针可以用了然后就可以丢掉了。然后以后那么那个有一个笔，那个胰岛素在笔里面的那个笔也可以丢掉，然后就比较没有那么麻烦，而且也已经没有痛了，因为那个针很小，4米，以前是8米，现在已经有新的是4米，就也没有那么痛了。So this was the first guy, Leonard Thompson, in which he was given insulin. Now this is a quintessential, this is the example of a person who has 0 insulin. They definitely need insulin and no oral medications will help. 这是那个第一个给胰岛素的那个小孩子，他这个呢是一个比例，就是100%没有胰岛素，没有一个服药，没有一个口服的药可以帮忙他，他只能打胰岛素。这个是他打完胰岛素之后，然后他从没有胰岛素的阶段变成现在是肥胖胖。以前没有胰岛素的话，他的细胞不可能用那个糖为功能。如果不能用的话，他就好像没有食物一样，所以他就很瘦。So he was starving in plenty, basically without insulin. Insulin pushes the sugars into the cells, if you remember, and is used for fuel. So without the fuel, the poor patient was basically starving, even though the glucose was very high in the blood, and that's why he looks as he is. So if you remember the slide, and you remember that why we need insulin, and there's a difference then between. If you have diabetes, generalizing simplistically, you have diabetes and you look like this, and you have diabetes and you look like this. It's a little bit different in terms of what medications are used, in terms of what is the underlying basis and the underlying issues that have gone wrong for that would give you your diabetes. So 要看不同的那个身体的形状呢，有不同的。为什么有糖尿病是不同的哦？就好像那个小孩子，他很小，他很瘦，他100%没有胰岛素。那么如果你看这里的话，你如果是肥胖的人，就很多对胰岛素的抗体。那么如果是这样子的话，他的胰岛素虽然不是很少，可是不够，因为那个抵抗力很高，所以你的胰岛素所以的胰岛素变成不够了。那么如果你越瘦的话呢，那的胰岛素的抵抗不是它是多半呢是它的胰脏那里产生制造能力的功能已经越来越衰弱了。So this is a little chart that shows at the diagnosis of at 0 minutes when you first diagnosed with diabetes, you already have 50% of your insulin capacity. And as the time progresses, it goes down pretty quickly. So let's say if you are 10 years after diabetes has been diagnosed, you have so little insulin, or the amount of insulin is not that much already. And in that situation, you might come to a situation where you can't just have all the medications. All the medications, no matter how good they are, is not going to work for you. 如果在刚刚知道你有糖尿病的阶段，已经是50%的功能，胰脏的功能已经是少了50%了，然后每年逐渐的它会逐渐的衰弱。所以如果说你有5年的糖尿病的历史，或者10年的糖尿病的历史，你的胰岛素有可能真的也是不够了。那么如果你多少次口服了多少药也是没有用，也是于事无补。你最需要的还是胰岛素。So what we do when we look at the treatment, we individualize to two things. One is the level of control of the diabetes, and one is the medications, as I mentioned it, no one size fits all. So when we talk about level of control, Dr. Ng mentioned about HbA1c, reduce 7%. When I say we individualize, if someone has diabetes and is going to die in 3 months' time because he has terminal cancer, I allow the HbA1c to be higher. If someone has many complications and is very old, with kidney problems already, I allow the HbA1c to be higher. But the younger you are 30, you are 40, you have diabetes, you have such a long life in front of you, I want my HbA1c to be the best I can, and I want it as low as less than 7%. If I can have it less than 6.5%, I will do it. And that's why when I say individualized, it's in terms of not just the level of control, it's also the level of control of diabetes. And again, depending on what type of diabetes you have, what is your figure, what is the main issue behind the diabetes problem, we will decide on the medications that we want to give. So 我们个性的话，不单是血糖的水平目标，也是药物，不是不同的阶段，不同的那个身体的构造、身体的形状，我们有不同的药物可以给，没有一个是这些没有这些全部都是个性化的。So 这些是广泛的一个种类的药物。一个呢是减少抵抗，对胰岛素的抵抗 ，and it's metformin， 这是双瓜。一个是增加胰岛素，这是 sulfonylureas， 是 一个是 sulfonylureas DPP4 as well as GLP-1。那另外一个是增加尿液里面去除葡萄糖，那个是 SGLT2。一个是减少吸收那个碳水化合物的吸收 ，so the alpha glucosidase inhibitors。最后一个呢，是真的是需要的，是那胰岛素。So we have different categories of medications, and these are just broad categories. And one of them is to decrease in resistance. And I mean, in generalizing, but the fatter you are, the bigger you are, there's a higher resistance. And the metformin would be very helpful in that terms. You increase the insulin. You cause the pancreas to increase insulin, and these are the 3 medications. You can increase the glucose removal in urine, and these are the medications. You decrease absorption, and also to provide what is lacking, which is insulin. At the heart of it, if you need it, you need it, and no other oral medications will help. So for the appropriate patients, the newer medications we are talking about, just 2 of them now, and very quickly. One is the GLP-1 agonist, and these 2 actually have weight loss. So for a long period of time, remember that at the heart of it is still weight loss. At the heart of it, we still need to lose weight. At the heart of it, why is the diabetes increasing? And that's because of obesity. That's because of increasingly being overweight, the population. And therefore, we need something that not just treats diabetes. And if we can treat both the diabetes as well as the obesity, that's a fantastic drug that I have. Now, I have 2 drugs then that I will be thinking about. One of this is a GLP agonist. It's an injectable. What it does is that it decreases, not only does it increase the insulin when the glucose goes up, but it decreases the appetite, and it also makes you full easier. So 最重要的呢是糖尿病的病率一直上升，是因为我们的肥胖率也是一直跟着上升。所以我们 最需要的呢是一个药有2种功能，一个是要糖尿病降低它的血糖，另外一个也是要能有一个瘦身的功能。那一个呢是这个，它让你不想要吃，而且它吃的时候也觉得很饱，所以最后变成减低那个卡路里，而说他们会瘦身，就3到4公斤或者多一点。So the second one is that of the SGLT2 inhibitors. So what it does is that it removes glucose from the urine. So basically, you also lose glucose from the urine, you lose calories, and that's why it can also lead to weight loss. And at the same time, because you're losing glucose, you are also decreasing the sugars. So 这个是第2个，这些都是新一点的药。那它是不让你排泄出那个尿糖。那么如果排泄出尿糖的话，它的糖也是有卡路里，所以它是有一点的瘦身的功能。But you need to understand that again, there's no one size fits all. It does not mean that these drugs are appropriate for everyone. And they all have their own side effects. Everything that you put into your mouth, you must think of the side effects. But it's always the risk and benefit. 你要明白，不是说新药很好，我朋友有可以吃这个药，这个药给我很好的我的朋友很好的帮助，那我也是应该能吃的。这是没有是个性化的，没有说100%的哦，不是全部人都可以适合这2种药或者其他的药啊。我们讲了很多的那种不同的药，那不是说全部人都应该吃3、4种或者不同的药也要看他的并发症，也要看他糖尿病是怎么样。So remember, for everyone is different. What's most important then is there are any doubts, you have to please not stop the medication without discussing with the doctor. You need to sit down, you need to discuss with the doctor what are your goals of therapy, what is the level of control you want, what complications do you have of it, what good friends does the diabetes come with, and how then you have to discuss how then is the best way of treating both the diabetes and all the complications and all its good friends. What medication works best for you? And you should not just because you don't like the sound of insulin. There are many myths and misconceptions about insulin. I think my next speaker will speak about that. And I don't want you to just because you don't like insulin, just because you're afraid of the needle. I have shot myself not with insulin, but with the needle. It is not painful. It is 4 millimeters, and I don't have much abdomen fat. Okay? So 我觉得是最重要的呢，是每一个人是不一样的，不是说你的朋友有了一种药，对他的糖尿病有好的帮助，那就是说那个药是适合你的。你是要看你的并发症，你是看你糖尿病是什么阶段了，需不需要胰岛素而且还有其他的并发症也是有影响到要怎么选择那个药。那么若有疑问的话，我觉得是切记，请勿停止服用药物，而必须与你的医生讨论。So, well, the next thing is we're just going to end soon, about 5 more minutes. Very important is that this healthy lifestyle must come with medical treatment. So we can't just speak about medical treatment without talking about a healthy lifestyle. 最重要的是不只是要给你们吃那个药物，你要有一个健康的生活。没有一个药物可以，如果那个药物是多好的话，你的食物上不要警惕的话，也是没有用。Well, this is just me being rebellious. And what is in common? What's the thing that you have is common? 什么相同的东西在这里？ Rice, okay? Me. Because there was this thing about someone saying that, no, rice is not good, and so we should kill the rice now. I love the rice. If I can't eat rice, just kill me now. I mean, seriously. Everything is in moderation, okay? So 一切要适可而止。谁叫你吃一盘鸡饭？你不用吃一盘鸡饭，对吗？可以吃1/4，对吗？那个sushi不用吃那个饭，吃那个sashimi咯。最多是吃一个哦，对吗？那个沙煲 share with your friends. So, well, we talked about the soldiers who are fighting the war. We talked about the enemy. We talked about the weapons. 我们讲了什么是军人？糖尿病对抗糖尿病的军人，什么是糖尿病？我们是要讲的武器。 我们讲的不同的武器，没有一个是个性化。记得切记，糖尿病有好朋友，记得也要看那个有没有好朋友，而且糖尿病有并发症，全部在看一起，然后又要个性化的呢，不单只是他的糖尿病的水准，它的控制水准是要多好。另外一个呢，也是不同的药物，如果适当时候需要胰岛素，就是需要胰岛素哦。Well, this is just to show that it's not just in Singapore, it's all over the world. From 2003 until 2025, you can see that it's increased. The estimated increase from 2003 was 72%. 我们在不单是新加坡有问题，国际上也是有问题。我们新加坡人越来越肥胖，国际上也是越来越肥胖了，尤其是中国啊、菲律宾啊这些不同的地方。So what 我们现在在对抗的呢，不只是糖尿病，而是那个肥胖。你也知道为什么？所以我们有肥胖和糖尿症流行病，所以变成这样子了哦。So now we know it as the diabetes epidemic. It's an epidemic because it's rapidly increasing. This is getting out of hand, and so really we need to know about it, and we need to then fight it. So, well, this I actually wrote in Chinese, so they didn't translate it. I wrote this. It says, 国家有难，匹夫有责. So basically, well, that's why you don't have the English version here. So what happens is that, well, if the country is at war, if the country is in trouble, every single one of us should be out there to fight the war. And remember, it's not just you. It's not just people who have got diabetes already. Most importantly, 50% of them running around with diabetes do not know that you have diabetes. So you need to start from then. You have pre-diabetes, you need to prevent it. How do you prevent it? You need to take care of your health, your obesity. Try not to increase weight. But most importantly, what about your children? Your obesity starts from young. If you look at them, they're eating like crazy. And then in order to stop them from crying, you just give them the candy. Here, yeah, you can have it. Mommy, I want. Yeah, you can have it. Here, you can have it. And whatever they want, you give it to them and look at their weight. And you love it when they are pang pang, because especially the grandmothers and the grandfathers will love it when they are a little bit fat, right? Because they look cute when they are fat. Every one of us, I feel, plays a role in this. If you leave it to the diabetologist, if you leave it to the doctors, I think it's not going to be enough. So you need to start young. So 我觉得，所以为什么呢？我觉得每个人都要有这个负责的话，是因为从小很多肥胖率是从小开始的。所以如果我们从小的话就没有去执着这个问题的话，以后就是以后的就是越来越糟糕了。Thank goodness we have arrived at the end. I've been struggling like crazy. So at least I can say that if you've got any questions, I think we can leave it to the end. And if you need to, you can also email me those questions. So thank you very much. 谢谢。